everyone, and welcome to Greater Mount Carmel Baptist Church of Scotlandville Health and Wellness Ministry virtual series. Let's build a better family health history, mind, body, and spirit. Today we have a wonderful tag team that's in the medical field, amongst other things. We have Dr. Jonathan Roberts and Judge Tiffany Foxworth Roberts. Dr. Roberts, can you elaborate a little bit more on your experience and your medical history?
Well, basically, I'm a Baton Rouge native, and I am also a Southern University graduate, and then from there I went to LSU Medical School in New Orleans to complete my medical degree. And then after completing my training, I returned to Baton Rouge to practice.
And where are you presently practicing, Dr. Roberts?
Currently, I am practicing at GenCare Senior Medical Center in New Orleans, Louisiana.
Very good. Tiffany?
I am a graduate of Southern University School of Nursing. I've been a registered nurse now. Actually, this makes my 20th year, so it's my 20th year anniversary.
Amen.
I have worked as a nurse in the clinical sector. I'm working in the areas of telemetry, pre-op, post-op, surgery, well baby nursing,
Oh, yes.
in a various number of different arenas. I've worked as a travel nurse. I was a registered nurse in the Army.
Okay.
And I've done clinical research likewise at Walter Reed Institute of Research. And so my medical experience is both in the areas of as working as a clinician and also in research.
Very good. As you can see, guys, we have two heavy hitters here. And as you know, February is Heart Health Month. As you can see, Tiffany and I are sporting our red to represent those women in red. Well, today we're going to go through a series of questions that our two clinicians will tag team and answer. So our first question for our team, what is the difference between heart disease, heart attack, and heart failure?
Well, heart disease involves a variety of conditions related to the heart and the cardiovascular system. Heart disease can be anything from coronary heart disease to heart failure to heart attacks to other conditions specific to the heart, such as infections of the heart, such as endocarditis or myocarditis, which is involvement of the heart muscle, which can be a separate disease, not related to ischemic heart disease, the more common term of heart disease in terms of heart attacks or angina.
So tell them what ischemic means. What is that?
Yes.
Ischemic means lack of blood flow to a specific area of the heart.
Okay. Okay.
Yeah, usually from blockage of one or more of the coronary arteries.
And and when you have that blockage, is that one of those things that could possibly be corrected?
Yes, it can be treated medically and surgically.
Okay. And what are the warning signs or symptoms of heart disease?
Well, heart disease signs and symptoms can be any of a number of various symptoms, and the most common one that most people associate is chest pain. Chest pain that can occur usually in the middle of the chest. Sometimes it could be on the left side of the chest or even the right side of the chest, or it can even be in the neck or the upper abdomen. Other common symptoms of heart disease are just shortness of breath. It can be arm numbness or arm tingling. It could even be neck pain or headache or just sweating for no reason, especially in women. It can be other nonspecific symptoms which one does not usually attribute to heart disease, such as just not feeling well, such as feeling anxious, such as just feeling more tired than usual. Sometimes it can be nausea or generalized not feeling well.
So
And all those symptoms.
So there is a specific difference between the signs and symptoms for men and women.
Absolutely.
I think with women, sometimes the symptoms are masked as to where a woman is experiencing things but don't necessarily realize them because the signs and symptoms manifest differently. Also, there are a lot of people who experience what they think is heartburn or indigestion, would you say?
They say,
Yes.
gas.
Yeah, I feel air in my chest. You know, if you were to break it
Exactly.
down to what you feel, it feels like air in your chest, you know, pressure on your chest. And so I know, like, I grew up between grandparents, and especially like with a lot of older people, they'll go take like some baking soda or take some Tums or
Bicarbonate.
something like that. And in essence, what they can be experiencing is early signs and symptoms of heart failure or a heart attack that, you know, they attribute it to be something that they have experienced in the past.
Okay. Now I noticed that with our athletes, a lot of them have questions dealing with a sudden death syndrome that's in reference to heart disease.
Yes, in athletes, like college athletes, even high school and professional athletes, oftentimes heart disease can be manifested in people who you think are in pretty good shape physically, from physical appearance, but it doesn't mean that there's not a problem specific to the heart that might be present. A lot of college athletes now undergo mandatory cardiac screenings, and even high schools need to be doing this too. One of the local organizations here called Jumpstart Your Heart, I think, is making provisions to screen even high school athletes for underlying heart disease, which sometimes can be manifested as what's called sudden cardiac death. In other words, an athlete may be performing athletic an event and sometimes may either pass out or even sometimes even just die without any warning or symptoms at all.
I actually have a question. I know that especially in our younger, the younger population, you often hear about people being diagnosed as having heart murmurs.
Yes.
Would that be a factor, or is that a contributory factor towards that?
Yes, it is. That could be one of the signs and symptoms of, there's a specific cardiac condition specifically seen primarily in athletes called hypertrophic cardiomyopathy, which is basically enlargement and structural change in the heart, often detected on echocardiography, ultrasound of the heart. And this is a screening that's usually done in high school and college and professional athletes.
Now, once that diagnosis is seen, what is the process of, is that a process that can be corrected, or is that something that is a permanent addition to their?
Usually that condition is treated medically.
Okay.
It's treated with medication to control the heart rate, to control the blood pressure, and to control the heart's rhythm.
Well, that segue into the next question. What is a good heart blood pressure number for men, women, and young people?
By known standards, blood pressure normally should be 120 over 80, if you had to equate it to a number, 120 or lower.
Okay.
There are blood pressure goals depending on other medical conditions. Somebody could have a blood pressure example of 90 over 60, might be normal for them, but maybe too low for somebody else.
Got you.
Some people may have a blood pressure of 140 over 80, which may be good for an older individual, but not necessarily for somebody who has diabetes.
So now, is there such thing as different races having different rates of blood pressure, or is just a common number that you guys utilize?
Basically, the number is a standard for everyone, regardless of race.
Well, I know in recent years, there was, in the past, if blood pressure was greater than 140 over 90, it was deemed to be high or hypertensive. But they have recently reduced those numbers, correct? I believe it's 130 over, is it 130 over 80?
Yeah, that may be an acceptably normal blood pressure for certain populations, yeah.
Okay. Now, does sport-enhanced drinks or supplements help or hurt the athletes?
I guess it depends on what supplements are in the drinks that are being consumed. Certain sports energy drinks may have high levels of caffeine other drugs which we call sympathomimetics, which tend to raise the heart rate and tend to raise the blood pressure, which can be potentially harmful if they're consumed in excess quantities.
Okay, so you would recommend definitely to be checked by the physician prior to starting those type of supplements or enhanced sports drinks on that level?
I think what needs to be paid attention to is what is being consumed.
Okay.
And how much of these supplements are in
What's
the
going
drinks
into
and
your body.
what's being consumed, yeah.
Now, since we are in the COVID situation that we're living in, is it true or false? Is it true that COVID-19 does affect our heart and lungs?
That is true.
And once a person has COVID, is it recommended, or do you recommend that they get their heart and lung checked after they have recovered from COVID-19?
I think anybody who tests positive for COVID-19, they ought to be under the care of the physician, and the individual physician use their own clinical judgment as to what cardiac or pulmonary lung testing should be performed. The virus itself can affect the heart, and it can cause structural changes in the heart, leading to heart disease and sudden cardiac death, which is often seen in younger individuals. It can also affect the lungs too, because the virus attaches to cells in the lungs, causing shortness of breath and respiratory failure, leading to people having to be intubated and placed on ventilators.
So do you recommend those who have questions about the COVID shot, do you recommend that they do take the shot?
Yes, we recommend that everyone, excluding somebody who has a contraindication to getting vaccinated, be vaccinated for COVID-19.
COVID-19.
Because that's the only way that we're going to stop the spread and stop the pandemic, that enough of the American public is vaccinated.
I think studies have suggested that it would take approximately 75% of the American population
75-80%.
to be vaccinated in order for us to curtail this as a pandemic.
Wow.
So that's a large percentage, and I know that there are a lot of questions and a lot of doubts from people as it pertains to the safety aspect of the vaccine. I myself, I must admit that I was very concerned about that too. When you factor into the equation that there was a rush on the vaccine, that there have been billions of dollars invested into creating a vaccine. With pharmaceutical companies, they stand a lot to gain with being the first or being the ones who actually created the vaccine. It's a $1 trillion business industry where there's lots of money to be made. And then, of course, you have the government that people may or may not trust because, they often put things out to the American or give information to the American people based off of where they may or may not give all the facts. And so I definitely can understand the questions that people would have as it pertains to whether or not they can get COVID-19 if they take the vaccine. If they take the vaccine, does it reduce the risk of them actually getting the virus, or what's the level or percentage of effectiveness if they take it? I want to say even with the flu vaccine, it was maybe, 55% effective? And so to take the shot and have something introduced into your body, and then it may or may not work, 50% chance, is something we just really don't know a lot about. That can raise a lot of question and doubt, with people. But then if you do like a risk analysis to determine the rate of effectiveness versus the risk of not taking it, it could definitely be an advantage for us to take it. I can say that I just recently took my first shot. There are a lot of places in the community that are offering the shots, and they are free of service. It's not just to your first line defense of medical health care professionals. are those who are in the at-risk or vulnerable populations at age 65 or greater. They're offering it to everyone. With veterans, we're both veterans, and the VA outpatient clinic here in Baton Rouge actually offers it. They offer it in New Orleans also at the VA Medical Center there. So there are a number of different outlets within the community. And today I actually saw on social media that Living Faith Christian Center has shots available or vaccines available from 10 a.m. to 7 p.m. and Southern University has been a site. You mentioned Cara South earlier. So a lot of people just don't know where to go, or they have questions about the safetiness of it. With my first shot, I had no side effects at all whatsoever. And my husband took it. He's taken both of his vaccines. And we both had the Pfizer brand, and he had no side effects at all whatsoever. People can take Tylenol or something like that prior to pre-medicate themselves, but thus far I haven't really seen any major side effects as a result of taking the vaccine.
Very good. I'm glad you guys were leading by example, encouraging us to take the COVID-19 to protect ourselves. Yes, sir.
Let me interject that the two vaccines that are available now, the Pfizer vaccine and the Moderna vaccine, both vaccines are 90 to 95% effective, has been shown in clinical trials. Both vaccines are safe. Both vaccines are well tolerated. There are going to be some people that may have some mild side effects, most commonly being soreness where the shot is given, usually in the upper arm. Some people may have some low-grade fever. Some people may have some chills. But those symptoms are usually self-limited, and they usually go away in a day or two after taking the vaccine. There's going to be a very, very small percentage of people that may have more severe type reactions to the vaccine, requiring special medications and even observation in a hospital. But there have been some reports, but very, very, very few. Okay. But for the most part, the vaccine is very safe. It is very effective. We recommend that all people, especially people who are elderly, 65 and older, people with chronic health conditions such as chronic heart disease, chronic lung disease, or diabetes, be vaccinated. Because that's the only way we are going to win this pandemic war, is to get vaccinated.
Right.
Okay. And one thing that I did find interesting that I wasn't even aware of until I took the vaccine myself was that it has not yet been FDA approved. Whoa. And so that was something that I was surprised to learn, that it has not been FDA approved. This is the Pfizer again. This is the one that what I was vaccinated with. And so, when we say that it's 99, or what's the percentage? 95%. That's as it's been reported thus far. Being that it's something that's still relatively new on the market. At the end of the day, people, we don't want to give people part of the, the information.
Right.
People should be fully advised as to, not just the potential risk factors, but risk factors as we know it, being that this is something that's relatively new to everyone. And then people assume, since it's put out on the market and it's advertised as being safe, that it's FDA approved. But as of date, it is not.
Wow, that's some good information.
We also have to keep in mind that even if we have been vaccinated, it is not a replacement for continuing the things that we must all continue to do, such as mask wearing.
That's right.
Such as avoiding large crowds of people, such as hand washing, such as avoiding contact with sick individuals. For example, if you're sick with any type of illness, like a cold or any type of respiratory illness, you should stay home from work or school.
True.
You should avoid contact with other individuals. You must wash your hands frequently. You must continue to wear masks when you go out in public, or when you're not amongst members of your immediate household. So, but we still preach the message of the importance of getting vaccinated, in addition to continuing social distancing and other mitigation measures.
Well, you guys have given some wonderful information. Now we're going to move into a different direction, specifically for our Black women and how we should learn to love our hearts. And one of the questions that I have, how will menopause, and y'all can tag team this, affect a woman's heart?
Well, menopause doesn't directly affect a woman's heart. However, studies have shown that there's a hormone that's in the blood, estrogen. As we increase in age, the amount of estrogen in our bodies decrease. And estrogen has been shown to increase the elasticity within the arterial walls. And so if the arteries are able to be flexible and move around, the blood flows through, so your heart is properly oxygenated, and thus that can maintain a positive effect on the heart. But in contrast to that, studies have also shown that people should not use replacement therapy for estrogen to counter the effects. That there has not there's not been any indication that replacement therapy would curtail or decrease that as a risk factor, as a known risk factor. It's actually encouraged that women continue to do things like exercise, maintain healthy diets, stay within their appropriate weight limits, as far as their heights are concerned, and just have a healthy lifestyle. Those things will help greater than anything else, especially as we get older, reach the age of near menopause, and I think right now it's about 54 or greater. And, our metabolism slowed down. So as things slow down, we just have to do things to keep it going.
So as things slow down, we need to increase our activity, our level of activity.
Yeah, and it's recommended that we engage in at least 150 minutes per week of some type of physical activity.
Got you. Now, what kind of tests or things that we do that they have? Are they specific tests for heart disease for African American women?
I think he wanted to piggyback
Oh,
on
yes,
that.
go ahead, please, Doc.
Yeah, the thing about estrogen in women, postmenopausal women.
Yes, sir.
The risk of unopposed estrogen use are real, such as increased risk of certain forms of cancer, like breast cancer, increased risk of what we call thromboembolic disease, such as blood clots in the lungs and blood clots in the lower legs. So that's why we try to stray away from estrogen use in women who are postmenopausal to treat symptoms. We use other drugs to treat menopausal symptoms. Yeah, for those reasons. Yeah.
So what does as an African American woman, and I'm going to the doctor, what can I do to help you guys help me? So what information should I bring to you to help you better understand what's going on with me?
Well, any doctor that you see, and for any woman who goes to a primary care doctor for a physical examination should make the doctor aware of their family history, make the doctor aware of all the medications that the patient takes, along with the woman's personal medical history. Certain physical examination findings such as blood pressure measurement, pulse measurement, height and weight, something called a body mass index, which is a measure of height over weight.
Okay, is that the BMI?
BMI, body mass
Okay.
index, right. Anyone who has a female who has a body mass index of 27 or greater is considered to be obese. And obesity should be controlled as best as possible, usually through diet and exercise, and in some cases even medical treatment.
So, Doc, let me ask this question. So how early should an African American woman or young lady start checking out her heart?
Well, I guess that just depends on medical history and risk factors. Certainly, any woman, depending on age, irregardless, should have their heart screened or checked. With simple, depending on the age and medical history, certain tests are used.
Okay.
In otherwise healthy 20-something-year-old females not necessarily do an electrocardiogram or an echocardiogram. unless there are symptoms suggestive of underlying heart disease that a doctor would be able to determine.
And then another thing, I firmly believe that early detection is the key to prevention. You know, especially within our community, a lot of our increasing rates of morbidity and mortality are a direct result of lack of education, of lack of proper screening. We should, even as children, we take our children to the doctor on an annual basis for a checkup, and if we don't, we should. You know, that's a way that you can catch things as they come about, because sometimes you don't see the classic signs and symptoms of things that you're experiencing, or you can write it off or as something else. You know, so I would encourage women, especially Black women, to have an annual checkup. And it doesn't have to be a diagnostic test such as your echocardiogram or electrocardiogram. Even with blood work, blood chemistries, you know, where they just draw blood, they can check your cholesterol levels, they can check your sodium levels. And that's one of the things that affects us at a larger rate, where there is a great disparity amongst us as Black women. You know, we have so much that we have to deal with.
Right.
You know, as most of us are working women, we have families we have to take care of, children, general stressors of life, and stress is a major
Yes.
contributory factor towards heart disease and, you know, all of the symptoms and things that manifest therefrom. And so we need to learn how to manage our stress, our diets. Our diets are huge. I want to say that studies have even suggested or shown that, you know, as a race of people, you know, this is not even just specific to Black women, but Black men too, may carry a gene, or some people actually do carry a gene that makes them sensitive to sodium. You know, so as to where you can have another race where they can consume sodiums in higher quantities, we have a greater resistance to it. So with the foods that we eat, especially in South Louisiana,
Yes,
crawfish
Lord.
season, that
Yes.
gumbo,
Oh, my
and
goodness,
you know, all
yes.
that good food that we love to eat. You know, when we're in those type of environments where we're wanting to consume the foods that we want to eat, and we may have a sedentary lifestyle. There are people who may not know their family history. Whenever you go to the doctor, they take a complete physical and history when you walk in. But there are other people who don't really know. My mother was adopted, and we're from the South, so it wasn't even a traditional adoption where they do the background and
Right.
tell all about the family history and all that goes along with it. It was something along the lines of, okay, you want a baby, here is a baby. But you don't get all of
the
the background from
information.
either parent. You know, I know that both of my biological grandparents are deceased, but from what, I have no idea. So when we don't know, we have to take the initiative to say, well, okay, these are ways that we can live a healthy lifestyle. No smoking, no excessive drinking.
right.
Make sure you get adequate hydration with water. It's the best thing that you can drink. Eliminate those high fructose drinks,
Yeah.
like your Coca-Colas,
High
and
fruit- yeah.
we out here in the South, we love our sweet tea with all that sugar in
that
it.
cane sugar.
Yeah, that cane sugar. Eliminate that stuff from your diet. All that fried chicken, that good old Popeyes. You know, we have to eliminate these things from our diet and take a proactive approach ourselves to a healthier lifestyle. That's the best way that we can combat some of these things. And then, of course, once you get past the age of maybe your 20s, start checking your blood pressure regularly yourself. You can get a blood pressure cuff at any local area pharmacy. They sell them for maybe about $20. Check your blood pressure. Even if you don't have it, when you can just stop in. The pharmacist will check your blood pressure.
Right.
You know, just check it regularly. Make sure you're okay. I have a friend who has a son, and he is 16 years old. She's a nurse. She's playing around at home and just so happened to check her son's blood pressure and realized, or she found out, that her son's blood pressure was high. So I was talking to her the other day. She was at Children's Hospital with him because they have been monitoring his blood pressure and his heart based off of a discovery that she made just messing around, checking blood pressures, although he had no signs and symptoms. In fact, they still don't know the underlying cause of it, but now they know to watch.
Yes.
So when things like this happen, this can help prevent this, the athletic induced with
Cardiomyopathy.
cardiomyopathy.
Right.
You know, that can help prevent some of these things, but not everyone has a parent who is a nurse at home.
Right.
So that's why it's important that we talk about these things. We open up dialogue so that we can start taking a proactive approach, you know, to being better stewards over our health.
Taking better care of our temple. So from the information that you told me, we can change our heart history if we make those minor changes. And this question I have for you, dealing with the blood pressure, and let's say they've been diagnosed and they're taking the blood pressure medicine, is it true that they have to stay on it the rest of their lives, or can they be weaned off at some point?
Well, in the average person who has hypertension or high blood pressure that requires medical treatment, sometimes people can be weaned off some blood pressure medicine when their blood pressure stays well enough controlled. And there are going to be some people that are going to require lifelong therapy based on the severity and other cardiac risk and medical risk factors for heart disease and stroke. So, but yes, in some cases, yeah, blood pressure medicine can be taken off, but it varies from individual to individual.
So are there any natural ways to improve our heart health that are out there?
Yes, like for example, if you're overweight or obese, losing weight, changing your diet, becoming more physically active. If you smoke, stop, and if you don't smoke, don't start.
Right.
Okay. But yeah, those are things that you can't change your genetics or your family history.
Right.
But you can change your lifestyle and your other modifiable risk factors such as weight and tobacco use and physical activity. And all those things do help. You know.
There are some other things too. I think that a reduction of your sodium intake could have a significant impact also. There are also other foods that we may or may not have heard of that can help, like consumption of garlic, things of that nature, apple cider vinegar, soybeans, black beans, celery, carrots. There are a number, green teas, these are things that have been shown, especially in our indigenous populations and third world countries where they don't have access to medical resources and medications the same as we do here in the States. They have utilized a number of holistic approaches to combating hypertension and heart disease. So with that, if we adopt some of these lifestyle changes, and I'm a huge proponent of plant-based diet. A lot of times people don't want to have that discussion, but plant-based diets has shown, would you agree or disagree?
Yes, I agree.
Yeah, plant-based diets, things that come from the earth. Don't oversaturate your foods. Make sure your foods can breathe.
Right.
These are if your food can breathe, your internal organs can breathe.
That makes sense.
I have a book at home called Preventing Heart Disease, and that book primarily talks about the power of plant-based diets in terms of reversing and even in some cases eliminating heart disease.
Yes,
if you stick to a plant-based diet, and it gives specific foods to eat and foods to avoid, which have been shown and proven in clinical research to reverse, like foods like beans, for example, foods like asparagus and broccoli, avocados, bananas,
Kale.
Right.
Yeah,
Yes,
that's another big
spinach.
one.
Your super greens.
Big ones.
Right, those
the greens, and this can be found in pretty much any health food or health bookstore.
Right.
Yeah.
Right.
And I'll be the first to admit, it sounds good to say it, right?
Right.
But that
right.
discipline is hard
Oh,
to live
yes.
by
Oh, yeah,
because
absolutely.
food tastes good. It's almost like the worse it is for your body, the better it tastes. But we have to be able to be disciplined in our approach. And, I'm not saying just go there 100, 1000%, because I know it can be challenging at the end of the day. Like my aunt say, oh, you got to die of something. May as well die happy. Well, you don't want to just die happy. You want to have quality of life while
Right.
you're alive too.
Right.
So with that, you create balance. I've actually tried it before where I was on a plant-based diet for close to about 6 months.
Okay.
And I never felt so good in life. I have problems with my stomach, with the bloating, and I had indigestion, heartburn, a number of different things, swelling of extremities. It eliminated all of that. Even with my skin, I could definitely see a difference in my skin. But it can be challenging to
Right.
live here and be that disciplined to stick to that type of diet.
Right.
But just, do it in moderation. If you're going to eat red meat, although it's not recommended,
Right.
especially for a heart-healthy diet, do it in moderation. If you're going to eat fried food, reduce it down to maybe once or twice a month. Maintain your exercise. If you're going to eat something bad, don't drink something bad in conjunction with it. Drink water along with it. What you put into your body will have a huge impact on the results that you get as far as your heart healthiness is concerned. And you can't live without your heart.
Right. Gotta have
you
it.
need that. You need your heart.
Gotta have it. Gotta
Yes.
have it. Well, we are coming to the end of our segment, and I just want to thank Dr. Jonathan Roberts, and also, she wears many hats, everyone. She's also Judge Tiffany Foxworth Roberts, who we will have again later for our social justice segment. But I want to thank them both for coming to discuss our heart health and our COVID-19 issues. And I am Nina Verrett Gibson. If you have any questions, please email the church so we can add that to the list of our series. And we want to thank you on behalf of our health and wellness ministry. Thank you for this segment. Let us build a better family history, mind, body, and spirit. We thank you, and we'll see you again soon. Be blessed and keep the faith.
I would like to thank you for the invitation. It was an honor and a privilege to be here, especially alongside my husband. I'm so proud of him and all of the works that he's done in the community, especially taking care of our elderly population.
Yes.
We know that they're vulnerable, especially in times like this, dealing with COVID, when they're losing loved ones, they're scared to come out. They can't socialize in the same manner in which they used to. I think it's very appropriate to have it here in church. This has been our safe haven, and a number of our elderly population can't come to church either.
Right.
And so any way in which we can give back to the community or be visible or share our gifts and talents that God has blessed us with others, by all means, we're more than willing to do that, to rise to the occasion. So I thank you for the invitation.
Oh, it's been a pleasure
And
to
I-
have you guys.
And I echo those sentiments. Thank you for having us. We're always willing to help anyone here in our community, whether it be medical issues or legal or judicial issues. We're always happy to help in any way we can.
Well, since we
Stay
are
healthy and stay safe out there, Baton Rouge.
at the end, do you guys have any final words or message for our audience to have as we close?
Yes, I want to reiterate again the importance of all of us getting vaccinated for COVID-19. The vaccines that we have now are safe and they're effective. The only way we're going to end this pandemic once and for all is for all of us to become vaccinated. Continue to practice social distancing, continue to wear masks, continue to wash your hands and avoid large crowds as much as possible. And yes, we will beat this pandemic eventually.
And in addition to that, February is also Black History Month, and February is Heart Healthy Month. So while you're at home and some people are just quarantining, make sure that you don't just don't put on a lot of extra COVID pounds. Make sure that you eat healthy, that you continue to remain social. You know, there are a lot of media outlets where you can have conversations or interactions with people virtually. So there are other ways and alternatives to this lifestyle as we've come to know it. So there is life after COVID. I definitely stay prayed up, stay safe, and know that, you know, this too shall pass.
Yes.
Absolutely.
So we want to thank everyone for tuning in, and we're going to leave this message to make sure that you guys mask up and stay safe. We'll see you guys later. Keep the faith.
Bye-bye.